I'm Dr. LaJoyce Brookshire. It is National Sickle Cell Awareness Month, and I want you to know that sickle cell is a disease which overwhelmingly affects African Americans, which happen to make up 80% of the disease. That's right. But it also affects people who are Hispanic, Indian, Mediterranean, and even Arab. Sickle cell anemia or sickle cell disease is a genetic disease of the red blood cells. Now, normally red blood cells are shaped like little discs, but with this disease, the blood cells are shaped more like a crescent. And because it's oddly shaped, it can't get through the very well, and it gets trapped. The blood cells get trapped, and that causes pain and tissue damage. Now, there is a difference. I'm sure some of you have heard of sickle cell disease and sickle cell trait. Sickle cell trait is when people inherit it. Both of them are inheritable diseases, but sickle cell trait is when one parent has it and they pass on those symptoms of the sickle cell disease. It's passed on to the children. So first, I'd like to talk to Dr.Cherilyn Lee. She's joining us by phone from the New Wellness Center in Marina del Rey, California. She is a PhD in nutrition, and she's certified in energy medicine. She's also a certified natural health care professional. Welcome, Dr. Lee. Hello, Dr. Lee.
I'm so sorry. I'm here.
Hi, Dr. Lee. Thank you. Thank you. All right.
Thank you. It's a blessing to be here. Thank you for this wonderful opportunity to share.
Thank you so much for being here. I appreciate you. Tell me, what medical problems have you seen that are caused by sickle cell disease?
Well, the cause, I see not so much the cause with the people that I treat, because, and overall, I do I know people have done by the time they come to me, they have had all their routine blood tests done. And I add some other things to look at some genetic nutrition defects as it relates to sickle cell patients, because most of the patients need more of the B12 folic acid, as we know. So I want to make sure that they're methylating, and meaning that is there a defect in the gene to actually get this into the cell tissue the way it should?
Okay.
So there's a real simple test that they can do, along with, this is just one of the factors, and that's called the MTHRS. And I say that because that will let me know if a person is able to methylate or to get if the body is able to break down the B12 and folic acid, so they can know that this is happening. So the things that I see that's causing it, we know is happening with the cells. You just explained that so wonderfully with sickle cell and what it is. But where do we go from there when we know that we have it? So what I do is look at all of the lab work, because if your inflammation markers are elevated, and that, especially the homeocysteine, and the homeocysteine is attached to those three vitamins, B6, B12, and folic acid, which will let you know that they're usually 99.9% that there is a methylation problem. So if a person starts taking the right formulation of B12 and folic acid, based on what's happening with the genes, they start to not have as many crises. And I don't see people that often in my office, because there are other things I do to keep them from going into crises as well.
That's like absolutely imperative, because that is primarily the issue. And when the flare-ups come, I know that some of the crises can be to the point where they're even hospitalized.
Right. Well, none of my patients are hospitalized anymore. They have found me through a referral, basically, and they try to come in once a month, and the ones that used to be in the hospital all the time. And if as long as they're coming in once a month I do what is called glutathione IV, which is a very slow push. And glutathione, as we know, is an amino acid, which is phenomenal it's an antioxidant, one of the powerful antioxidants, and then they get a modified, what is called Myers cocktail IV. So you get 2 treatments, and you don't have to be stuck with just one time, praise God. Just one time, and you get the IV drip first, which has your vitamin C in it, which is, we know, is very good for collagen, cell tissue, but it's really good with the cells itself. And the one thing that really helps with the magnesium added to it, what's called a Myers cocktail, but it's a modified because they don't use quite everything that's in the Myers cocktail, and it's modified based on that person's needs. No one has pain. No one has pain because you're becoming hydrated, pain-free. They walk out of my office like nothing ever happened.
Isn't that something? Now, can you do this for prevention before flare-up?
Yeah, this is why they try to come in once a month. Some of my patients I only see now once every 2 months because they're taking the right supplements too, because they had a gene mutation with their MTHFR. And people who are listening, I just like to tell them, you can go to lifeextension.com and order these lab tests for yourself. You don't have to wait and see if your doctor will order it. You can actually order that test for yourself. I think it's so empowering that people know what's going on with their body.
Now, say that one more time, Doc. The test that people can order on their own is
M as in Mary, T as in Tom, H as in Hurry, F as in Frank, R as in Rush or Richard.
Okay.
So it's on, and the website is lifeextension.com is the website. To go to the area of the website where it shows lab tests. Lab tests you can order on your own. So you can be familiar with this yourself. The good thing about it, when you know about that test, it is truly amazing when you know about this particular test because it covers everything from brain chemistry, importance of your mood, anxiety, and stress, your immune function, inflammation, energy production, detoxification of chemicals, and your cardiovascular health. So they do a combination of these 2 tests together.
Okay.
So you'll know if the pathway is blocked. So if you are sickle cell, you take the right nutrition, it's going to help as well. Yeah.
Okay. Super. That is fantastic. Well, Dr. Lee, I think you've said a mouthful and dropped the microphone. Thank you so much.
Thank you
for joining us. And we're going to also be seeing you in Las Vegas. So
yes, you are. I'm so excited.
I am too. I'm looking forward to it. So we'll talk more, and the audience will hear more from you. Thank you so much for joining us. All right.
Thank you for having me. It's truly been a blessing and an honor. Thank you.
Now joining us by phone on the line is Tionne, most widely known to the world as T-BOZ from TLC. Welcome, Tionne.
Thank you very much. Hey.
Hey, and Mr. Keir, who is a former record executive from Def Jam, Elektra Records, and Warner Brothers. He's a principal in a New York-based boutique marketing firm called Rhythm Alchemy. Welcome, Keir.
Good afternoon, ladies. How are you?
All right. I wanted to have the 2 of these wonderful people on today to have this conversation about sickle cell, as the 2 of them have suffered from sickle cell disease, and they both work in the entertainment industry, the high-powered entertainment industry. And Tionne has, of course, been dealing with grueling hours and grueling show schedules for her entire career. And it's interesting that, you've been very vocal, Tionne, about having sickle cell. And tell me what it's been like for you as a female with the disease.
I don't know if I could break it down. Only thing that to me makes a difference with the female aspect of it is that we just have a cycle, and you lose iron, and that makes it hard monthly. It's another part, but I don't know if I could break it down female versus male, because it's just a grueling disease no matter if you're a male or a female. But I do know for women it makes it harder just to have a cycle, which is crazy, and I never knew that. So every month around that time, I have to take it really, easy.
Yes.
as far as performing, flying thins my blood.
Mm-hmm.
My stress level is a big factor, which I have one of the most stressful jobs on the planet. So
Absolutely.
my doctor was like, great, you choose this job?
Mm-hmm. Okay.
Yeah. But I have to watch what I eat. I take a lot of herbal supplements daily. It's a daily thing. You have to upkeep, if you want to live.
That's
and
very
I
true.
want to live, so.
Yes. And you know what? I would say that you are very mindful about your timing and your rest and needing to get rest. And I remember back in the Arista days when I had the pleasure of working with you guys at you TLC ladies, that, I remember the record company wanting to stack your days so crazily. And I would be the one in the room saying, they need a day of rest. We can't.
Thank you.
You're welcome. And you know what? The last time I remember it was just you and I was you did the video shoot for Fled. Remember that movie?
Wow, yeah.
It was on Labor Day weekend, and I was seriously sick, and I was visibly sick. And you took one look at me and you said, "Go home." And I was like, "Well, I got to kind of like do you were like, no, I got that. Go home." And I never forgot you for that. I appreciate you for that.
Oh, you're sweet. No, that sounds like me. But yeah, because I feel like everything will be here, but if you're not here, we can't do anything anyway.
That's right.
So, yeah, the best thing is just to get better, and we will all be all right.
We surely will be.
Hold down the fort until you come back.
All right. Amen to that. Now, Keir, the one thing I know is that through all of the years that I've known you and through working in and out of the record industry, I never knew you had sickle cell. Tell me, what was it like, having the disease with the rigorous work schedule the entertainment industry required?
Well, I didn't hide it, but I didn't broadcast it either. A lot of people knew. I did have crises at various times during my work schedule.
Yeah.
And as you mentioned, flying affects you. High altitudes affect you. Denver is not the best place to be if you have sickle cell.
Okay.
Lack of sleep affects stress. All those things play into you going into crisis.
Okay.
So, and also, proper diet, which of course we don't always have, doing the running around that we do in the music business and entertainment in general.
Okay. Now,
So,
do you find that there is a stigma with the disease?
Yes, and unfortunately, the stigma is kind of on the medical side. I'm sure Tionne would agree. When you go into the hospital for treatment, they almost try to treat you like a junkie as a minority.
Wow.
Oh, my God, yes.
Talk about it, y'all.
Well, first and foremost, if you have any semblance of idea about the disease, like what you need, what painkillers you need, etc., they're like, well, you know too much. You're just coming in for the drugs.
Oh, my.
No, I'm not coming in for the drugs. I'm coming in to get balance, to have some pain relief.
Wow.
And the bad side about it is that once you're inside the hospital system, or especially if they find you have good insurance, they almost try to make you into the junkie they accuse you of being.
Whoa.
Because they try to flood you with all the narcotic drugs they get. Because sickle cell, because of the level of pain, all the drugs that we take to balance ourselves out are narcotic.
Okay.
Morphine, codeine, Demerol, Oxycontin, etc.
Tionne, what say you?
It's the same situation. It's kind of even harder sometimes because I'm an artist, so we're already, stereotyped as the rock and roll crackhead or drug addict.
Okay.
And so, just like he said, the three drugs that are used the most are Demerol, morphine, and Dilaudid. And I'm allergic to everything. And after Michael Jackson passed away, they really took, Demerol off the market, and that's the one that works for me. But I guess a lot of people were having seizures on that drug. But like you said, if you come in there and you're educated about your health, which you need to be, because I can't tell you the numerous of times, like how many times they've almost killed me. Dilaudid almost stopped my heart. And they'll still come in there with Dilaudid. I'm like, what part of didn't I tell you?
That's right, that I'm allergic to
this. I cannot take Dilaudid. It's just like they, if you're too educated, then you have to be a drug addict, because how could you know about these drugs? No, I know about these drugs because I've educated myself, because I'm tired of y'all trying to kill me, and I end up in the ICU because of someone's mistake. So just like a lot of people don't know when they come into the ER or even your, hospital room, if you're admitted, they have to call out every milligram that they're giving you, like, okay, I'm giving you 25 milligrams of Benadryl, I'm giving you 50 of Demerol. Like, you can't just come up to the patient and just administer medicine without telling me what you're giving me and what the dose is. And it's really smart to be your own advocate and to really learn what works for you and what does not work for you, because that will save your life, because it has saved mine on many occasions.
That is actually what I'm hearing from both of you, is that you must be your own best health advocate, that no one else in this disease or in any other disease actually can advocate for you like you can. And the stigma has been, though, that you've been bastardized for understanding what manages your pain. And I think that pain is very widely overlooked and not taken seriously because of the epidemic that we're in, especially now in the midst of this opioid epidemic. But I want you all to stay right there because we've got some questions from the audience. So don't go away. We're on the line with Tionne T-BOZ of TLC and Keir, and the two both have sickle cell disease, and we're having a conversation about it right here on Ask the Good Doctor. Don't go away. We'll be back after this. Welcome back to Ask the Good Doctor on Sirius XM Urban View, Channel 126. I'm Dr. LaJoyce Brookshire, discussing sickle cell disease with Tionne from T-BOZ and Tionne from T-BOZ. Tionne from TLC, known as T-BOZ, and Mr. Keir, who also worked in the entertainment industry. Thank you both for joining us. Now, Keir, I have a question for you from James on Facebook. He says, I'm living with sickle cell disease, and it looks like men are hit harder than women. What do you say about that?
Well, I can't make that determination. Believe it or not, I have not met a lot of women with sickle cell. I've met two. Unfortunately, one of them is no longer with us. But I'm sure I'd be willing to say, like the T-BOZ mentioned earlier, that women may have it a little bit more difficult because of the monthly blood loss.
Yeah.
You know, blood is the essential factor in the sickle cell equation. So to lose blood is a major detriment.
Okay. All right.
I just wonder why he thought that. Like, I'm curious to know, like, why he thinks that, because, I don't never break down anyone's pain, because I would watch my cousin, and he's no longer here, and I used to feel like he had it worse than me, and he used to feel that way about me as well. And so, but I know women have babies, and, any trauma to your body causes your sickle cell crisis to flare up.
That's actually the next question, T-BOZ, from Gordon on Facebook. He writes, my wife and I have sickle cell anemia. After our child was born, it seems that my wife took a turn for the worse. She can't get back to being 100% again. She wants us to have another baby, and I think she may never bounce back if she does. Tionne, you have a child. How did you bounce back?
Well, my daughter almost killed me. It almost took me out of here, but I got her here. Amen. And, and if anybody asked me, I would do it again. But, that's why I adopted my son from birth, because I knew I couldn't have another baby, because I knew it would kill me. I went into a coma for 3 days. And, but you know what? I got her here, and I don't cry over spilt milk, but I will say this about his wife, and because as a woman, even if you're 100% healthy, it is hard to bring a child and a life into this world. It's hard on your body.
Yeah, they take everything from you.
Yeah, and so if you have a disease, we have to work 10 times harder. So I would suggest that, the medicines, I don't know if he'll agree with me, but the medicines to me keep us in a weakened state.
There you go.
That keeps you weaker. So I don't know, when we do have crises, they come more often. So what I do is I take a lot of herbal supplements to build up my body so that when I do have a crisis, it's not as often. And, for those who are scared to get into holistic things, they're all natural, and they derive from plants and the earth. So you can take them with your medications that the doctor prescribes.
That's true. And you weren't on the line when we had Dr. Lee on telling us how she treats her patients in her wellness center with glutathione and infusions. And I can see that being very effective as well. I have a question for both of you. How do you know when you're headed toward a crisis, and can you prevent it from occurring?
Which ladies first?
Tionne?
T, let me go first. Okay, I'll go into it.
Okay.
For me, oftentimes, ironically, crises or the beginning of crisis oftentimes happen at night.
Okay. Oh.
And so you'll feel a little bit of pain. You'll feel typically joint pain.
Mm-hmm.
I call them warning shots because
Mm-hmm.
it's sickle cell pain, but it doesn't go into a full crisis.
Mm-hmm.
So it's manageable. So you'll be kind of limp or hobble around for a day or two. For me, it may affect my elbow. It may affect my hip flexor or my knee, but typically the hip flexor or my elbow or the hip wrist. But in general, it affects your joints.
Okay.
And it's usually maybe a 5 or below pain wise. Once you go about 5, it tends to start to increase. That's when you know you're heading into a crisis.
Right, and you didn't know that you had this disease until you were 19.
Yeah, I actually, my freshman year of college, I found out.
Wow, I find that remarkable.
Yeah,
oh, wow.
yeah. It
so
was,
you lived that long without really realizing you didn't have it at all? That's amazing.
I know it was. I had no crisis. I had no real crisis.
Wow.
Ironically, I grew up in Detroit, Michigan, and it didn't happen until I moved to Texas. And I do believe it was the climate change that precipitated it.
Yeah, it was.
Absolutely. Yeah, that heat.
Climate change also gives us it can go from winter to summer to fall to spring every 3 months or 4 months or so.
Mm-hmm.
Sicklers start getting achy because any climate change brings up a crisis, and that's why it's so hard on tour because we're in different cities every night.
Yeah.
And that's the part that I was ruining all kind of tours every time. I just
remember.
Now, the last 2 years,
I remember.
got a hold on not getting sick and figuring out, my fluid intake.
Yes.
Because that really made a difference. And I carry around a concentrator, so I take oxygen before the show and after the show. Yeah. And I kind of treat it like how athletes do, really.
Yes.
Like I'm about to play a game or something. You know what I'm saying?
Mm-hmm.
A lot of
She
stuff
touched on
we do
something.
is the same as
very
athletes,
important.
I notice on tour.
Yes.
Right.
Go ahead, Keir.
She touched on something very important, and that's oxygen. The reason our cells sickle is because of the depletion of oxygen from our cells.
Okay.
So anything that you can do to oxygenate your body helps sickle cell.
Mm-hmm.
So, of course, that's fluids because we derive most of oxygen from drinking water and so forth. Things like Gatorade really, really work well because they help with the electrolyte balance and really rush fluids to your body.
Okay.
So those are sort of things. Those are sort of things that you want to adhere to.
And may I recommend a couple of things. As a naturopath, what I recommend to people who come to me with sickle cell, like you say, the lack of oxygen is one of the issues, and that's because there's not enough iron being transported. So the first thing I recommend is an organic iron called liquid organic liquid organic iron. It's a ferro food, and it does not constipate, and it replaces beautifully. And also for the oxygen, the transportation of the oxygen is the green products, a multivitamin, multi-mineral green that has been cold pressed. That's very important. One I like is Amazing Grass or Green Vibrance, and that has lots of micro minerals and micronutrients in it. But the density of that, and if you put that green powder in conjunction with like a beet juice, oh my gosh, it's like life. It's actually like giving yourself an infusion. And
wow.
Yes.
Yeah, I love juicing too. Like
yes.
I do that a lot. And also, with kale being a natural anti-inflammatory, because a lot of us carry inflammation, which is some of the reason why some of us get pain, because some of us also develop arthritis.
Yep.
Because that's just basically stiffening of your joint.
That's right. So
juicing is a very, very, very great thing to do. And also, too, I do infrared saunas.
Yes.
I do oxygen baths, and I take this stuff called cell food, and it kind of puts oxygen in your drink. Cause
I love that.
The one thing about what I've learned is our skin is our biggest organ.
That's right.
So if you put oxygen straight into your bloodstream and your skin, basically through oxygen baths and different ways like that, that's helping us internally as well.
It really is. And Keir, I want you to replace that Gatorade drink with coconut water, which has more electrolytes.
I do that one also.
Okay, good.
I do that one also.
So mix the Gatorade.
Like to bring up.
Yes, it doesn't have the artificial sugars and it doesn't have stuff in it you can't pronounce. So stick with what's natural, and you'll be A-okay. Now, I want to know, did the doctors ever warn you all against teaming up personally with someone who may have the trait?
Oh, yeah, absolutely.
Yeah.
Okay.
You mean as far as a mate is concerned?
Correct.
Okay,
yeah, my daughter is a trait carrier, so
okay.
whoever, she's very educated. She's clear that whoever she ends up marrying and having a baby with, that she could, possibly give her child, sickle cell. And you have to be careful, too, of the other blood disorders, because my parents gave me sickle thal, which is sickle cell SC mixed with beta thalassemia.
Wow.
So I checked my husband for every kind of blood, anything.
Yes, as we should.
Before I had Chase.
Yes.
Mm-hmm. Right.
How old is Chase now?
Chase will be 18 October 20th, and I cannot believe it. I'm just like, no.
Oh, my gosh. That's fantastic. Happy birthday, Chase. Well, I want to thank both of you for educating us about sickle cell disease. It's good to know that while there's no individual cure for the disease, with appropriate care, anyone can live long and healthy and productive lives as these two. And I want to ask each of you, tell me, you know what? T-BOZ, I ran into Snoop Dogg coming into the station today, and I said, T-BOZ is going to be on my show today. He was like, I need to be on that show.
Yeah, you know what? I have a charity event, and I'm actually having another one, and he actually performed at my sickle cell charity event. It's called T-BOZ Unplugged, and that was my absolute favorite one that year. And I was so excited. I was like, oh, my God. And you know what was crazy?
Tell me.
He had the nerve to tell me thank you. He was like, you know what? Thank you for letting me do this. And I'm like,
so sweet.
What? That is so crazy. I'm like, I adore you for helping me, spread awareness and everything. So I am having another one, and, it's where artists come out and they help give a benefit concert, because I felt like, people love music, and why not merge both my passions?
That's
you
right.
Can give back, save a life, and have a good party.
That's right.
At the
good
same
one.
time with good music with the people you love. So it's called TBOZunplugged.com. And we stream it simultaneously across the world if you can't come in person. But it's October 14th in North Hollywood at Avalon.
Okay.
This October coming up. So
wonderful.
It's a fun event, and I just thank him so much for, supporting me and my cause. And he's amazing. And you have to tell him that, like, I will tell him the next time I see him. Really love him.
Well, I love that song you all did together back in the days. Way back. I love that.
Yeah.
Yes. Okay. Thank you. My pleasure. Keir, what's your social media?
My social media is Rhythm, RHYTHM, Alchemy, ALCHEMY, at Gmail. I'm sorry, on IG.
On Instagram. Okay.
Yes.
I know you're about to give the email. Hilarious.
I love it. Well, thank you both, T-BOZ from TLC and Keir Worthy. I thank both of you. No one would ever know that you all are enduring what you have, and may God continue to bless you both. Remember to follow me on Twitter at Ask the Good Doc, on Facebook and Instagram at Ask the Good Doctor, and the new YouTube channel, Ask the Good Doctor LaJoyce Brookshire. I want to thank my team who make everything go, IW and Jamel and Winter and Mahogany and Dana. And I want you all to join me in Las Vegas at the live event on September 28th at Sahara West Library. It's free, y'all. If you'd like to attend, send me an email at askthegooddoctor@msn.com. That does it for me. I want you to know that in order to let your eyes shine, cut back on the wine, get good food fast, and go easy on the greasy. I'm Dr. LaJoyce Brookshire. Until next time, God bless you.